Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. My name is Lex Frieden. I'm Senior Vice President at TIRR, the Institute for Rehabilitation and Research in Houston, and I'll be your host for today's program. We have a great guest and an interesting program for you, and I'll introduce our guest right after I ask this question. This question we'll try to answer before the end of today's show. When was the first U.S. law requiring that schools include people with disabilities in their classes, in the school program? When was the first law affecting people with disabilities' access to public schools passed? And we'll try to answer it before the end of today's program. Now, it's my pleasure to introduce to you a friend and a real contributor to access for people with disabilities in Houston, and that is Jaquie Brannan. Jaquie, welcome to Focus on Abilities.
Thanks, Lex.
It's nice to have you here today. Jaquie, you have your own law firm.
Yes.
And you're also the legal director for the regional office of Advocacy Incorporated. Is that correct?
That's right. I'm the managing attorney there.
And what Advocacy Incorporated, first of all, is what?
Advocacy Incorporated is a legal rights organization. It's the U.S. Congress mandated that every state have a protection and advocacy agency in each state, and Advocacy Inc. is that agency for Texas. So we advocate for the legal rights of individuals with disabilities, regardless of whether they have the money to pay, and we cover all kinds of disabilities and the entire spectrum of disability law.
Now, in Houston, we are in the regional office of
Yes.
Advocacy. What area does that cover?
We have 28 counties that we cover. So this whole part of Texas, going up, we have a satellite office in Nacogdoches, and we have one down in Beaumont, and there are 6 regions, and we cover these 28 counties that are in this
Essentially
part.
southeast Texas.
Yes.
Jaquie, how many lawyers work for Advocacy Incorporated?
Statewide, we have a great number because there are at least 2 in each region, and then there are several in Austin. But here in this region, we have 2.
In addition to the lawyers, you have other staff that help to work on these projects?
That's right. We have community specialists, and they are specialists in their own areas, such as the mental illness area. We have specialists in our CAP program, the Clients Assistance Program, TPAS, the helping people that are on Social Security disability get back to work here in Texas, and our DD program, which assists families who have children with disabilities, mostly in public schools, but even into adulthood as they need other services.
Now, you take all cases that people that call, or they come to you, or how does that work?
I wish we could take all the cases, but the Board of Advocacy has priorities that they set every year. And so that's sort of the first level of screening, is that it has to meet our priorities. And if it does, then we will usually look at the case, see how we can help. If we can help, then we are able to take that case.
What are the current priorities?
Well, there are many of them, pages and pages. It would take way too long, but we have them set up for each area.
So suffice to say, people who have issues, people with disabilities or family members,
very often it's family members.
And,
yes.
and they may call Advocacy Incorporated
Yes.
and find assistance for issues that are frustrating to them?
Definitely. We have intake hours in the morning between 9 and 1, but they can call anytime and get other information even. A lot of times people just need information, and Advocacy Incorporated has great handouts and booklets that we send to people at no charge, so that they can get the information that they need.
Jaquie, what mostly do people call about?
It is so varied. It's impossible to say. Every week, I'm in charge of going through all of the intakes that have come in that week, and there is no theme. People call from psychiatric facilities to help with discharge planning. People call because they're...
Excuse me, people who are in the psychiatric facilities?
Yes. By law, the psychiatric facilities have to have signs with our number on them so that people know that they can call for assistance.
Wow.
And they do, and people, parents of children that are not getting the services that they need from school, people who are having trouble getting vocational training so that they can go back to work, just a very wide spectrum of calls.
How do people know about advocacy, aside, of course, from watching this show?
I think just because we've been around for a long time, and we put out a lot of literature, and we do a lot of speaking, a lot of outreach to the community. And
So many social workers, probably, other lawyers, people, advocates in the schools and so on, they probably all know about Advocacy Incorporated.
it's very seldom that I meet somebody in that setting that hasn't heard of Advocacy Incorporated.
And for somebody who's watching this program and need to be in touch with you, how can they do that?
Our phone number at Advocacy is 713-974-7691.
713-974-7691.
Excellent.
And Jaquie, in addition to the work you do at Advocacy Incorporated, you also have your own firm
Yes.
called Jaquie Brannan.
It's a Brennan Johnson law firm.
Okay. And in that work, what do you do?
The firm itself is a full service practice, so that as a firm we pretty much cover everything. Every lawyer has their own areas of focus, and at the firm I do just disability law, and that was always what I wanted to do going through law school, was to focus on disability, and so that's what I did. I was able to focus on disability law. The more lawyers I brought into the firm, the more I was able to do that.
Now, you said that from the time you were in school, you were interested in disability law. What prompted that? I mean, did you wake up one morning and have, from a dream and decide you wanted to be a disability lawyer?
No, not exactly. I went to law school late in life, not right out of college. My husband and I were foster parents, and we got a foster baby when they called us to tell us about this foster baby, he was 3 weeks old, still in the hospital, and they said, there's a neurological impairment. We're not sure what it is yet, but he has a lot of delays. And I was so naive, I thought, 3 weeks old, how delayed could he be? He's 3 weeks behind everybody else,
Yeah.
So we took him as a foster baby, went through all of the medical and physical therapy, occupational therapy, the medical testing, everything, so much with that baby that our whole family, at that time we had 4 children, just fell in love with this little boy. And so eventually we asked if we could adopt him, and that sort of started us down the road to adopting children with disabilities. We ended up adopting 5 children with disabilities, and that's what got me interested in disability law, really advocating for them.
My goodness, you had four children of your own to begin with.
I had 4 children by birth. They're all my own.
And you adopted this child. What did the child's diagnosis turn out to be?
It turned out to be Prader-Willi syndrome, which is a chromosome abnormality, a tiny little missing piece of the 15th chromosome on the Q12 arm.
And what does that cause from a functional standpoint?
It's kind of an interesting disability just because it's unusual, and it involves mental retardation, usually to around a moderate level. That kids, when they grow up and become adults, they usually function in about a 9 to 12-year-old range, which is actually not a bad range to fall in. And but the most, I guess, unusual feature of it is that the hypothalamus is affected to the point that they are always hungry, and even if they've just eaten a big meal, they'll still feel like they're starving. So being hungry all the time, they will they're very, very resourceful in finding ways to get food.
Wow.
And we have to have locks on everything, and the pantry, the refrigerator, the freezer, the trash, everything has to be locked up. And since we have so many other children, sometimes we forget. And this little boy, who is now 15, can eat quite a bit if he's allowed to. And in fact, one of my favorite stories about Paul is in Prader-Willi syndrome is him going to school, changing to junior high, me being worried because they had vending machines, asked the principal, could we move the vending machines? They did. But after the first 6 weeks, he'd gained 12 pounds. So I said, something's wrong. I called the principal, and she said, oh, I'm so surprised because he's doing great. He's reaching out to other groups of kids. Every day he has lunch at a table with blind students. So apparently they had lost 12 pounds in those 6 weeks because he was taking things out of their lunch to get his food. So.
My. And there's physiologically, I mean, there isn't any pill or treatment for that yet.
No, they've certainly tried everything, and no, there's nothing seems to work correctly because of the source of the problem.
He's 15 now. He's in
15.
school.
Yes.
Doing well.
Yes, doing very well.
And is he athletic? I mean, does he exercise well?
No, he's on the big side, and but he does love to try to do some athletics and really enjoys watching. He's a very big sports fan. He can always tell me the scores of the games.
And consciously, I mean, he has a sense of his own limitations in that regard.
Yes, he does.
So he probably, as he grows older and matures, he may develop some self-control.
Maybe, but it's hard because it's you know, it's just a gnawing hunger. It's not like just, oh, when we get hungry and we try to stick to a diet. It's way more pervasive than that, yes.
And Jaquie, the kinds of issues that you ran into with this child in school, did your law, but you didn't have a law degree when you adopted that child?
No, not at all. I didn't go to law school till after we had all 9 children. So, but at that time, I just looked into the law and what protections existed and what rights he had. And I found that in some ways I got more for him than other parents were getting. And I knew it was because I had looked up the magic words to say. And that's what really got me interested and started us kind of down that road.
Okay, we want to talk more about your experience in law school, your experience with 9 children, 5 of whom you adopted, and how your career relates to your kids and to other kids in society. We'll come back to that right after we take this break from Focus on Abilities. Please stay tuned. We'll be back with more with Jaquie Brannan.
You know where to find the best tasting, most nutritious, and most affordable meals in Houston? Right in your own home. And we're going to show you how.
Welcome to the Houston Food Bank's Operation Frontline, where we bring in local chefs and dietitians to teach classes in preparing healthy meals on a low-income budget. To find out how you can support Operation Frontline, contact the Houston Food Bank.
Here's everything that you need to prepare these meals for your family.
Thank you so much.
Welcome back to Focus on Abilities. I'm Lex Frieden, and we're here today with Jaquie Brannan. Jaquie has her own law firm, and she's also with Advocacy Incorporated. And Jaquie, we were talking about your children. After the first child that you adopted with a disability, you adopted 4 more.
Yes.
Now, were the circumstances the same, that you took them as foster children and then adopted them, or how did that work?
No, actually, when we adopted that baby, that gave us 4 boys and only 1 girl. So we had Danny as my oldest, then Kendra, then Colin and Sean, and then we had Paul. So my daughter felt like she was really outnumbered and wanted to adopt a little girl. So we told the agency that we fostered through that whenever they got a little girl with disabilities, we would like to be considered, and we knew it would probably take a long time. Well, 3 days later they called and they had a baby who had something called Mobius syndrome, which she's cognitively normal, but she had a facial nerve that was missing, made her look like she had had a stroke maybe on that side of her face. And so we adopted her, Megan, and then after that we had a foster baby who had Down syndrome that we fell in love with, and he went to another family. So we tried to let everybody that we knew, including agencies around the state, know that we wanted a baby with Down syndrome. We got lots of calls. They weren't about babies with Down syndrome. We finally sat down as a family and said, you know, there are a lot of babies waiting, but there's not the baby with Down syndrome. Do we want to take another baby? And we all agreed we did, and we would really listen to the next phone call. And it came about a 3-year-old little girl in Dallas who had actually been adopted as a baby, and then they didn't know that there was anything wrong with her. After about a year, her adoptive family knew that there was something seriously wrong, and they actually took her back to the adoption agency and asked to have the adoption rescinded. And we had seen a story about her, in fact, on the national news, because the judge in that case refused to terminate their parental rights until another family was found. And so we adopted her, not knowing really what her diagnosis was. We got that a little later. She had Angelman syndrome. And then there was a lot of press about that story because it turned into a big legal battle in which we had to intervene. It was my first experience really with any kind of court proceedings, and it was in national magazines and national talk shows. And during some of that publicity, someone asked my husband if we would ever want to adopt again, given all the trouble we were going through. And he said we still wanted to adopt a baby with Down syndrome. So the birth parents of a 6-week-old with Down syndrome called us and said, would you adopt our baby? And we did. And then a couple of years later, someone else who was expecting a baby but had found out that the baby had Down syndrome asked us to adopt their baby too.
But before the baby was born?
Yes, we were there for the birth. The baby did have heart problems, and they were planning to do surgery, and his name was Tyler, and he died when he was 2 months old. You always hear that's the hardest thing a parent can go through, and believe it, it really is.
So I was counting, and I thought you went past the number of children that you had. Jaquie, you said in the beginning that you consulted with your family. The other kids, your first children, how old were they at the time?
They were still relatively young. I think they were like 12, 10, 6, and 5, something like that.
So you brought them into the decision about whether to adopt more children or not?
Oh, sure. It had to be a family decision because they were the ones who were going to be sharing everything to bring more children in.
So the sharing things in terms of what the family had, but also helping with the kids?
Definitely helping. People always say, how do you do that? And it is because the older children are so great at helping the younger children. And, the younger children help each other. It really is a complete family effort in that way.
And, have you ever, I won't ask you if you've ever had any second thoughts, but are there ever been challenges that you've had that have made you think twice?
Certainly, all the time. In fact, the child that we adopted that had no cognitive problems, that just had the missing facial nerve, we expected she would just grow up as any of our normal children had, and it would have, there would be no real difficulties with her like we would face with the others. And it turned out that her difficulties started in junior high because her face did look different. And so she went through a lot of teasing and went through a lot of withdrawal and depression over that, and had to have some psychiatric treatment because of the teasing of others and the bullying of others.
So that was like a secondary effect
It was.
of the primary disability.
Yes.
And in terms of the expenses associated with the medical issues, psychiatric issues, and so on, are these all expenses that you and your family have borne?
2 of the children, when we adopted them, they came with an adoption package that included Medicaid. Paul and Kelsey, the little girl with Angelman syndrome. So they both have Medicaid, but the other children are covered under our private insurance. And luckily we have really good private insurance. Expensive, but good coverage for them.
Yeah, that is good. Jaquie, now, at some point you decided to become a lawyer. Was that simply because you realized kids like this and their families needed professional assistance to deal with some of the issues you'd run into?
That was really a big part of it because I was trying to help parents on my own, realizing that I wasn't an attorney. I was acting as an advocate, but I thought it would be easier to do that and more productive if I became a lawyer. And I thought lawyers made a lot of money. Who knew? But that was, my husband wanted to retire, and we knew there was pretty much no way that was going to happen unless I was doing something else, and I decided to go to law school.
And it's as simple as that. You went to a law school and applied and passed the entrance exams, and shortly thereafter you were a lawyer.
Yes, seems like a lot longer than you made it sound, but yeah, I applied only in town to the 3 law schools in town, but I was accepted by all of them. And I went to the University of Houston Law Center and Actually got out a semester early, took a lot of extra courses in the summer and finished up as quickly as I could, and started my own firm right out of law school. I clerked at Advocacy Incorporated. I was a law clerk at Advocacy, and I also helped with a project called Healthcare Matters through Advocacy when Medicaid and Medicare rolled out their managed care here in Harris County.
Right. And in terms of your profession, do you really feel like the effort you put into becoming a lawyer was justified?
Every day I do. Because people come to me as a last resort, I think, most of the time. They've exhausted everything they can think to do on their own. They've read as much as they can, and they need help, and they need a voice in the legal system. And it seems so easy to just say, oh, I'll handle this case on my own, but it's so difficult to do that if you're not an attorney. And I always tell people, it's sad, but it's true that having an attorney really does help, especially in advocacy situations. When people come to me and they can't get into a restaurant because there's no ramp, or they can't get into get their children's services from schools because the school won't listen to them, or we've been getting a lot of calls about restraint in schools and seclusion.
Restraint, like?
A lot of teachers have been restraining students who they believe are out of control.
What do you mean by restraint?
Well, sometimes it's as simple as holding them to where they can't move, but it has gone farther than that. And
my goodness.
Where people have duct taped children to chairs, that was just a couple of weeks ago we had that call, or have been handcuffed.
In the 21st century.
Yes, it happens so often. In fact, I think those are the cases that we're hearing most about, because only last year did the state legislature pass a law that provides reporting mechanisms. It doesn't say you can never restrain a child, but it does say that when you do, you have to tell the parents within 24 hours. And so parents that didn't know their children were being restrained are now finding out because of this reporting mechanism. The legislature is thinking about right now about allowing schools to waive that reporting, and we're going to be fighting against that this week, because it would be just tragic to take that step back, because in so many cases, a very egregious case that we had recently, the child was being restrained 8 to 10 times a day. That's how often they were reporting it to the parent.
But Jackie, that seems like it's not just a violation of disability law, but it's a moral infringement.
I agree with you.
That's quite amazing.
We've had some kids that were secluded in the courtyard at school to the point that they got sunburned because they were out there so many hours, just being isolated from the rest of the students. Those are serious
That's a severe
problems.
brand of timeout, I'll tell you that.
Yes, it is.
Jackie, do you find that being a lawyer, sometimes you can deal with a situation the same as you did before you were a lawyer and get different results?
Definitely, all the time. I mean, sometimes that's all it takes, is to have a lawyer. And sometimes it's because I can just talk to the lawyer on the other side, and the lawyer on the other side will know that what we're asking for is reasonable compared to what the school has done, whereas a principal or a teacher may not really know the law. I've run into that a lot. Least restrictive environment is one of the main things that we fight for in special education laws, so that not all children can maybe be in the general ed classroom all day, but they should be in the least restrictive environment. Right. And I had a special education teacher tell me once, well, wouldn't outside be the least restrictive? And she was really thinking of physically restrictive and didn't really understand the concept at all. So when teachers are trying to advise parents about the law, or tell parents this is what the law is, parents need a lawyer to know whether that's true, because sometimes it's not that the school is trying to mislead the parent at all. It's because teachers don't know what the law is in this area.
Are schools getting better?
I don't think they are in some ways. I think in some areas, yes. Inclusion, definitely. They're bringing more children into the regular education classrooms. But discipline is becoming a huge issue. And when they adopt zero tolerance for some things and some behaviors may be a manifestation of a child's disability, too often schools are just sending the child to an alternative education program, what's called an AEP, a disciplinary AEP, away from the school, rather than really looking at what could change the behaviors and how these behaviors really are part of a child's disability.
And Jaquie, what about the programs where the parents and the student meet with the teachers and the counselor and so on, and have essentially a plan? Does that system work?
Well, it still goes on, and it works to the extent that the people that are involved make it work. Developing good, what are called individual education plans, IEPs, developing good ones are not that hard. Having them implement those in the classroom is a little tougher, because not all classroom teachers are able or take the time to implement every single thing that's on the IEP. And it's the law once it's on that IEP.
Having been a parent and not a lawyer, and later having been a parent and a lawyer, what advice can you give to parents, probably who are not lawyers now, in terms of ensuring that their kids have the best education even though they may have a disability?
Sure. Know as much as you can. Get educated and get involved. Those are the main things that will see your child through. I've had parents call me and say, I'm just so tired of dealing with ARD meetings, and their child is 7 years old and they haven't even begun to have to deal with ARD meetings yet. So it's hanging in there on that. You know, it is getting help when you can. It's getting help from advocacy organizations, from organizations that provide parent advocates to go with you, and sometimes it means getting a lawyer to help
And
you.
one place to get help is Advocacy Incorporated.
Definitely.
Brannan and Johnson.
Yes.
Other advocates who may be helpful as well, I'm sure, in the community.
Yes.
And Jaquie, the answer to our question at the beginning of the show had to do with the first law that was passed, the U.S. law that ensured access to schools by children with disabilities. That was the Education for All Handicapped Children's Act in 1975, I recall.
Yes, you got it right.
Jaquie, in conclusion, just let me thank you for all you've done to help kids, your own, those in Houston, and please come back and be our guest on a future Focus on Abilities.
I would love to.
Thank you very much.
Yes.
And thank all of you for watching Focus on Abilities. This is a program presented by the Municipal channel in Houston. We're glad to be here. We're glad you are, and we'll see you next time. My name is Lex Frieden, and we'll wrap up and see you next time.
On September 11th, America faced terrorist attacks of the worst kind. Innocent lives were lost, and a sad cloud was cast over this great nation. These acts were intended to cause fear among all Americans, including our children. But we cannot let that happen. There are things we can do to help our kids. Talk with them, listen to them, tell them they're safe and that they're loved. God bless you, and God bless America.
11-year-old Maddie Stepanek is a best-selling poet affected by a rare form of muscular dystrophy.
A champion is someone who never gives up, even when the going gets rough. A champion is a member of a winning team.
A team of scientists, doctors, and volunteers is working to stop Maddie's disease and save his life. That team is MDA, the Muscular Dystrophy Association.
A champion is someone who overcomes challenges, a hopeful spirit.
MDA is seeking cures for diseases like the one affecting Maddie and his mom, the same disease that took the lives of his sister and 2 brothers.
There can be a champion in each of us if we live as a winner.
To learn more about MDA's efforts to win this fight for Maddie and others like him, call 1-800-572-1717.
A champion never gives up.